Hello, welcome back. The topic today is diabetes and wound healing. Whether uncontrolled diabetes or even blood sugar can affect the wound healing. Yes, definitely. This is everybody knows. Almost all diabetic patients they know very well. But how and why? So that is the answer. So diabetes, we all know it's a disease where the blood sugar level increases and it affects the blood vessels, especially small blood vessels. That's called microangiopathy, or even large blood vessels, but microangiopathy, small blood vessels, and neuropathy, nerve. The nerves are all affected, and so this is very important. So to understand more, in a simple way, suppose we have water and we put sugar in that, the water becomes more thicker and thicker. So the same way, when your blood sugar level rises in the body, your blood becomes thicker. So that cannot go into the blood vessels freely. So for wound healing, your blood has to flow freely. So the nutritions, your sugar, and everything has to go freely, and all the toxic things should be washed out. Now, because of the small blood vessels are all affected, and your blood is thicker, the blood flow is affected. So naturally, the wound healing is affected because the toxic things from the wounds are not cleared, and the nutrition is not going to the wound. So this is one part. The same way, suppose we have a sugar here, ants, flea, all these insects that come for the sugar. The same way, when your blood sugar level rises, infections can happen. So the bacteria, the virus, the fungus that can come causing wound infection. So that is why the post surgery, the sugar control has to be very, very important. So that is why the doctor sometimes temporarily they put you on insulin because of good sugar control prevents the wound infection. The third is high blood sugar always keeps you in a state of inflammation or your immunity. The immunity to fight the infection is very less. So they are easily prone for opportunistic infections. So fourth is your nerves are affected. The neuropathy, diabetic neuropathy. What is that? When the nerves are affected, you can get tingling sensation, loss of sensation. So when there is a loss of sensation, especially the pain tolerance will be more. They won't feel the pain. So if there is an infection, or suppose somebody have an injury in the foot, it will cause pain. But because of the neuropathy, they may not know the pain, or their tolerance is very high, so they may not give importance to that wound. So it's causing the infection or the wound to grow in non-healing ulcer. So those days, that is why the amputations were very common. So that is the reason why nowadays doctors, the diabetologists say every day it's a duty of the diabetic patient to check their foot, the sensation or any visible wound. This is very important. The next is all diabetic patients may have nutrition deficiencies because the diabetes drains their nutrition, especially vitamins, zinc. All these nutrients are very important for wound healing. So if they have a less of this nutrition, that can cause delayed wound healing. The same way, diabetics, if their protein intake is very low, the protein is very important for tissue healing. So infection, sugar, toxic things are not carried away. The sensation because of the nerves and nutrition deficiency, immunity, a lack of immunity, all these things delay or they will stop the wound healing, leading to infection. Infection, they may not be aware because of the loss of sensitivity to the pain. So if you have a diabetes and you are going for a surgery, especially planned surgery, the doctors may suggest temporarily for sometimes you put you on some strict diet and insulin, and probably that may be reverted back. But this is very important, and it's your duty to cooperate with the doctor, and you have to proper medicine, food, nutrition is very important. Thank you.